The 2019 AHA statement outlined best practices for outpatient BP measurement but did not address acute care settings due to limited data. Despite different contexts, the principles of proper BP measurement apply. Prepared by Dr. A. Habash. Challenges in acute care BP measurement include omission of critical contextual factors, significant variation in practices, and measurement differences by unit. These issues contribute to variability and inaccuracy in BP readings. Arterial lines are preferred for emergencies due to accuracy, while oscillometric devices may underestimate BP. Manual methods also show discrepancies. Each method has its advantages and limitations in acute settings. Special populations like pregnant individuals, older adults, and those with obesity require specific BP measurement considerations. Conditions like pseudohypertension and arrhythmias also affect accuracy. Hypertensive emergency assessment involves accurate BP measurement, severity assessment, and evaluation of target organ damage. A comprehensive history and thorough physical exam are crucial for management. Diagnostic investigations for hypertensive emergencies include laboratory tests, chest radiographs, 12-lead ECGs, and volume status assessments. These help identify complications and guide treatment decisions. Asymptomatic elevated inpatient BP is common, but management strategies remain unclear. System factors and frequent treatment despite limited data highlight the need for better understanding and guidelines. PRN antihypertensive orders can cause issues like nighttime administration disturbances, morning BP lowering, evening BP elevation, and increased variability. Avoiding PRN orders is generally recommended. Assessing asymptomatic elevated BP involves verifying measurement accuracy, repeating measurements, identifying reversible causes, and reviewing medications. These steps ensure accurate and effective management. Additional assessment considerations include monitoring heart rate, verifying home medications, and assessing volume status. These factors influence BP readings and therapeutic strategies in acute care. Outcomes of treating asymptomatic elevated BP show risks with intensive treatment. Observational studies suggest increased adverse outcomes with pharmacological interventions, highlighting the need for cautious management. Potential situations for treatment include persistent elevated BP, high cardiovascular risk, and resistant hypertension. Guidelines suggest using current clinical practice standards for decision-making. Summary of asymptomatic elevated BP management emphasizes treating as an exception, verifying readings, addressing conditions, considering oral medications, and ensuring follow-up. Evidence suggests cautious treatment. Disposition after an ED encounter involves addressing barriers to treatment, following clinical guidelines, considering oral therapy, and ensuring access to care. Health equity plays a crucial role in management. Critical factors for post-ED care include engaging community health workers, implementing specific care pathways, providing referral strategies, and exploring alternative care models to ensure effective BP management. Addressing health equity in hypertension management involves tackling economic and educational challenges, geographic disparities, and access to primary care. Consistent, high-quality care is essential for effective management. The Restore initiative focuses on community-based approaches, addressing social determinants, and developing equity-focused interventions to reduce hypertension disparities in under-resourced communities. Economic burden of hypertension management can be alleviated through generic substitutions, patient assistance programs, community health initiatives, and cost-effective alternatives. Understanding patient context is key. Future research directions include improving BP measurement accuracy, establishing treatment targets, understanding patient differences, and addressing transitions of care to enhance BP management strategies. A practical approach to asymptomatic elevated BP involves repeating measurements, addressing underlying conditions, reviewing medications, and considering oral options. Focus on non-pharmacological interventions is advised.